This is week 13, and you are 420. A topic this week is technology in healthcare, policy and practice implications. This is video 1. The role of technology in improving outcomes. Technology is crucial in improving outcomes from so many ways, and these are listed on these slides, but when you think about getting information, when I started nursing, being a nurse over 40 years ago, everything was on paper, so we couldn't get information. It took a while to get information from a person's old chart, to find out what their meds were. Everything took a long time because it was all on paper. But now we have access to patient information at the touch of our fingertips. Telemedicine and remote monitoring is crucial to helping us serve served areas and helping people stay in their homes and get timely intervention when they have health issues arise. It's so important. Electronic health records are so important for reducing errors, getting information right away. And then there are clinical decision support systems, which actually create algorithms and patient data. They use that to provide healthcare providers with evidence-based recommendations for diagnosis and treatment. And these can also improve patient safety and improve outcomes. So other ways that technology has helped to improve outcomes is the advancing medical imaging technology. I mean, MRI, CT scans, PET scans. We've just come such a far way in imaging. Also, robotics and minimally invasive surgery. A robot can be doing your surgery now and do it faster, more precisely, and with fewer complications and better outcomes. And then health information exchange. This enables the electronic sharing of patient information amongst providers, which will improve care coordination and reduce people running the same test that another provider may have recently run. And then patient engagement tools, using portals, apps to engage patients and have them more actively participate in their health care is a very important role of technology. And then there's data analytics and big data. This is where large data sets called big data are analyzed, and this allows organizations to see what trends are happening, predict disease outbreaks, make treatment more personalized, and improve population health management, just not patient health management. So adopting and leveraging and using technology is very important for healthcare providers and healthcare organizations to improve patient care. Some of the emerging technologies we see: artificial intelligence. I was at a recent conference where they said that artificial intelligence can determine whether moles or other skin lesions are cancerous or not with the same efficacy and more quickly than a physician. I think we always will need physician, but artificial intelligence can take all the knowledge about a certain condition or what things look like and predict whether or not the lesion or the symptoms are such that the person may have a certain disease. But it also helps to personalize treatment plans and take over some administrative tasks. The Internet of Medical Things refers to all the connected medical devices and applications that collect and transmit patient data. That includes wearable devices like even your smartwatch, remote monitoring systems, smart healthcare devices. This enables continuous monitoring of patients and facilitates remote care. Blockchain. This technology is being explored to secure and have a transparent management of patient records, supply chain management, and medical research. Basically, what blockchain does is it improves the security of all that data, and it makes it usable, but in a way that is much more protective of patient privacy. 3D printing is used to create customized prosthetics, customized devices. It can produce things more quickly and in a more cost-effective manner. And then robotics is being used for surgery, rehab, other sorts of patient care. Of course, I don't believe that this is totally going to replace the human aspect, but as an assistive, the robotics is very promising for the future of healthcare. Augmented reality and virtual reality are being used for medical training, patient ed, and therapy. They can put people, like when we have a simulation lab here, but with augmented and virtual reality, they can put you in an immersive simulation where you are sitting with these goggles on, and you are in a scene and have to provide interventions, and it could assess how well you provide those interventions. It's an adjunct. It's like a next level simulation. Genomics and precision medicine. This is basically personalizing medicine and treatments to your own genetic makeup to make things more targeted and effective. Nanotechnology is often used for targeted drug delivery, imaging, and some other diagnostics. They put nanoparticles inside of you, either to deliver medications to specific cells or tissues, or to you swallow the nano device, nanoparticles, and they provide imaging of your organs or areas inside. And then quantum computing has potential to revolutionize healthcare because it can solve complex problems like working on genetic analysis, developing drugs, figuring out models of diseases much faster than a traditional computer. So these are all driving innovation and have potential to improve outcomes and improve the patient experience. But whenever we talk about technology, we have to talk about HIPAA. HIPAA was basically established because of electronic healthcare records and other technologies. And it basically is to ensure, number one, that that our data is portable so that it can be taken from physician to physician or provider to provider, hospital to hospital, without having extra steps that need to take place. But a big part of HIPAA, as we know, is the accountability part, where we are accountable for the privacy of a person's health information. And it used to be a long time ago, when computers just started and they were rudimentary, you would find people looking up their neighbors or other people's labs or whatever on computers, which was unethical even if you could do it back then. But now with HIPAA, you can't just go around looking up people's information. So it's private, it's secure. So to make it secure, it may have to be encrypted. You have to have strict controls to access the information, and then audit controls to see who's looking in and out of those records. And HIPAA grants patients rights regarding their health information, including the right to get access to their medical records quickly and efficiently, and request amendments to their records. And they also have the right to know who their information is being disclosed to. Business associate agreements as part of HIPAA. It says that health providers must enter into agreements with billing companies or cloud storage providers, anybody who has that data, to make sure that that it's strictly outlined how these business associates are going to take care of the data so that patient confidentiality is maintained. There is a requirement called breach notification, where we are required to notify affected individuals and the Department of Health and Human Services, and in some cases the media, if a breach of protected health information occurs. And there are penalties for non-compliance. If you don't comply with HIPAA, you can have both civil and criminal penalties. Civil penalties, which is when an individual or group sues you, that can range from $100 to $50,000 per violation, depending on what the situation was. And then criminal penalties can result in fines of up to $250,000 in imprisonment. So HIPAA has had a very significant impact on healthcare providers, and it's made us even more aware of the importance of keeping patient information private. So the HIPAA rules, the privacy rule says that it establishes a national standard for protecting health information. The security rule sets national standards for protecting confidentiality, integrity, and availability of electronic protected health information. The breach notification rule, as I said, says that if a breach occurs, God and country needs to be notified. And then the enforcement rule outlines the investigation and penalties for violation of these HIPAA rules. And it outlines the process of imposing civil monetary penalties for noncompliance. The impact of HIPAA on providers. Compliance requirements, we all must comply. We have to make sure patients are aware of their rights and that we give them an accounting of their rights in writing that they sign off on, so that it is totally without question that they have been given their right to access their medical records and request corrections. Business associates agreements. These are now established, and a lot of times, even as a student, some of the hospitals may have you sign as a business associate an agreement saying that you're going to keep confidentiality. And then the impact, the penalties for noncompliance have caused people to pay penalties for not following HIPAA. Patient privacy, maintaining that is so important because it gives us the trust that we should have for our profession. It maintains trust. It protects a patient's rights to have access to their health records and some control over how they're used. It prevents discrimination. Certain health conditions are sensitive and can lead to discrimination in employment and in insurance coverage and in other areas. It ensures quality of care because you have to have open and honest communication between patients and healthcare providers. And if they feel that their information is protected, a patient is much more likely to reveal sensitive information. Compliance with laws and regulations. I think the development of HIPAA, and now that it's just like a regular part of our lives as professionals in healthcare, it has made it more likely that healthcare providers are going to be compliant. It prevents fraud and abuse because people can't access healthcare information fraudulently, which could lead to identity theft or billing practices that are fraudulent. And then it supports public health initiatives because the patient data is there and usable for research and monitoring of diseases. I thought it would be good to go over some HIPAA violations. I mean, we've become kind of tone deaf to HIPAA because it's such a part of our lives. But in 2010, New York Presbyterian Hospital and Columbia University Medical Center jointly violated HIPAA by allowing the electronically protected health information of 6,800 individuals to be accessible online. And they were fined $4.8 million and had to develop a corrective action plan. The Advocate Healthcare Network, they had multiple breaches between 2013 and 2016. 4 million people's electronic information was disclosed to an entity that it should not have been. They settled with Health and Human Services for $5.5 million, and that at the time was the largest settlement. They also agreed to corrective action. Triple S Management Corporation, it's an insurance holding company. It had a breach and 13,000 people's information was disclosed. And they settled for $3.5 million and implemented a corrective action plan. And I have the links to all of these cases on these slides. Signet Health, a health service provider, denied 41 patients access to their medical records and then did not cooperate with Health and Human Services investigation. And they were fined $4.3 million. That's the highest civil money penalty imposed at that time. And then the University of California at Los Angeles Health System, they had employees improperly access the electronic medical records of celebrities that were using their system. And they settled with Health and Human Services for $865,000 and had to submit a corrective action plan. So this first slide has mostly been about some trends, but a lot on HIPAA and the impact HIPAA has had. So have a great day, and I see you on video 2.